I wanted people to know that good, high quality treatment existed. And that has been my soapbox for the last couple of decades, making sure that people know that treatment exists and it works. And I think that is really the core of what we have to do here. We have to share outcomes. We have to publish our data. We have to speak out. I've spoken at almost all major high schools at some point during my career. We have to keep doing things like that, telling success stories of what works and how good quality treatment can save your life.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Carter Barnhart, co-founder and CEO of Charlie Health. In this episode, we discuss providing life-saving virtual care for people providing complex mental health challenges. Carter shares how Charlie Health blends technology and clinical insight to personalize care, track outcomes, and scale access. Plus, we talk about publishing real-world results, expanding into substance use disorder, and the company's mission to redefine mental health treatment one connection at a time. Let's get into it. The Fitt Insider Podcast is presented by EGYM. EGYM's smart fitness ecosystem is transforming healthcare through exercise. Combining strength equipment with AI-powered software and corporate wellness platform WellPass, it's leading the shift to proactive preventative health. Learn more about EGYM's intelligent workout solutions at egym.com. Hi, Carter. Welcome to Fitt Insider. Thanks for joining us.
Hi, Joe. Thanks so much for having me.
Yeah, excited to chat and lots to get into, but let's just start at the top. Why don't you tell us about yourself and Charlie Health, and we'll go from there.
Hi, I'm Carter Barnhart. I'm the CEO and co-founder of Charlie Health. We started Charlie Health to address a critical gap in the behavioral health system, which was how do you deliver life-saving care to people who are struggling the most and do that affordably at scale? We started over 6 years ago in Montana, a state of a million lives, and said if we can do it here, we can do it anywhere. We exist to make evidence-based, high-acuity behavioral healthcare accessible. We've proven that our treatment model works, that it is accessible, scalable, effective. We work with children, teens, and adults across the country, supporting people who experience complex mental health conditions, substance use disorders, or both. And we've grown rapidly. We're in 40 states today, contracted with over 90% of commercial and Medicaid insurers. And the real ethos of Charlie Health is connection. Everything we do is built around connection, personalization, and breaking down barriers to care so that hopefully no one has to wait more than a couple of moments before they're able to get into life-saving care.
Yeah, hugely important, topic and solution and care that you're delivering and much needed in terms of, you said, just removing barriers to access and making sure that people are able to get access quickly and then, personalize it to them. Much easier kind of said than done. And you describe it super succinctly in that explanation. But in terms of actually delivering that, and not to walk through each step of that journey over the last 6 years, but actually implementing that, making sure that you're delivering the quality of care that you want and then scaling that efficiently. What has that looked like and what does that look like today?
Like I said, we started in Montana. We started in a state where they had never had intensive treatment. And in retrospect, we probably should have started in a state that had intensive treatment prior to Charlie Health. But in the state of Montana, they had never had intensive treatment on an outpatient level. And so at the beginning, it was about just convincing people that something called intensive outpatient treatment could work. That's the core of our model, which means that you access care for about 9 to 12 hours per week, so more intensive than one-on-one. So we first had to convince people that that type of treatment worked. It's been around for decades, just totally underutilized. We then had to convince people that you could do that virtually, which, again, going back to rural Montana, working on Indian reservations, it was a population that was resistant to telehealth, like many, right? And so we had to convince them that not only does intensive treatment work, but intensive treatment works virtually. I joke with my team now, we've published a number of outcome papers, dozens of outcome papers, and we now have all of this credibility. We now get to show the effectiveness of our model. But just 6 years ago, we were going out and convincing people that something they didn't believe could exist and would work. It's a privilege to be able to sit here today and point to our white papers, point to our outcome studies, point to our published papers, and really how we're redefining clinical literature and show that through treating hundreds of thousands of people, we've been able to prove that effective care can be delivered virtually for this high acuity population.
Maybe, we could take a step back when you say started in Montana, started with a population that might be resistant to this. What was the genesis of that? Why Montana? Why that population? Why, going that route versus what you said, which is, hey, why don't we go somewhere where this is more accepted or more well known or established? How did that come about and that starting point? And then, you know, I can hear it as you're describing it, that journey, just like the resilience and the commitment and the kind of passion that you have to then make that work and be able to point to that and say, like, look, we did this. And in some ways, like, now what we're doing, not that it's easy, but we've certainly gone about it, in a challenging way to be able to prove what we're doing works.
A lot more proof today, that's for sure. You know, again, there was no good reason. We had been working on the idea for Charlie Health. I started Charlie Health with my co-founder, who at the time was just my boyfriend. And we were working on the idea for Charlie Health, and then COVID hit. And we were in Montana with my family and hunkered down there while the world shut down, and said, may as well try it here. And it was through initial meetings with just community members that we eventually were able to get to the senator and then to the governor and convince them that this was desperately needed in their state. While their emergency rooms were overflowing with COVID cases, they were also overflowing with mental health cases. You had kids that were at home 24/7 in abusive households who were showing up at the ER, not for physical trauma, but emotional trauma. And they needed a solution. And we were able to step in and be that solution. And then use that really as the case study. Again, a state of a million lives that had never had these types of services. We were able to show people what happens when Charlie Health comes into your state, how we are able to reduce the suicide rate. Our vision since the very beginning has been to build a world without suicide. We know that suicide is 100% preventable. All we have to do is ensure that every single person in crisis has access to Charlie Health when they need it most. We now have this proven care model that truly works. And I think in the beginning, it was just about getting enough people in so that we could create those case studies, so that we could then publish those outcomes and then tell the story.
Let's talk about what that care model looks like in practice, whether that's the actual how you're reaching and then onboarding patients, what the program looks like, then engagement, retention, and costs related to what you're doing.
So I'll start with, how do people get to Charlie Health? How do they find out about Charlie Health? Something that's unique about our model is that though we deliver care virtually, we're integrated with every community. We have 400 boots on the ground team members that are spread throughout the country in all 40 states that we're in. And their job is to form relationships with local ER social workers, with teachers, with the Starbucks barista, with whoever sees people in crisis. They tell them about Charlie Health, they explain what we do, they show our outcome studies, and they form relationships so that when that person sees someone in crisis, they're able to say, hey, you should call Charlie Health. Our competitor, when we launched, was just the local emergency room, right? So we needed to help people know that there was another option. When someone is suicidal, when someone is self-harming, when someone is in that state of crisis, you don't need to go to the emergency room. You can call Charlie Health. So the first piece is education, and it's all relationship-based. 90% of our patients come to us through local community professionals, doctors, social workers, clinicians. It's how they find us. We receive referrals also from the top 25 hospitals in the country. All of them refer to us and trust us with their patients. And it's through those relationships and the success of how their patients ultimately do with Charlie Health that we've been able to build that. Once someone actually enters care with us, we do an assessment virtually where we're collecting background information on that person and determining what is the appropriate treatment program for you. So if you were to come into Charlie Health through our virtual doors, we would collect background information about you, learn about your family, learn about your relationships, your job, your passions, your interests, and then talk about really what are you struggling with? Maybe you're working hard and people aren't being nice to you, to point to that sign behind you. Maybe you're struggling in your personal relationships. Maybe you have some childhood trauma, some things that you just haven't processed. We're going to talk to you about all of those things. We're going to understand really what's the why. What are you here for? And then how do we help you get connected to other people like you? Because that is the magic in healing. Connection is what heals these underlying traumas. It helps us feel less alone, right? And that was my own personal experience. I went to a group-based treatment program as a teenager, and it was through that I was able to heal from my childhood sexual trauma. And so really our goal during that assessment is to figure out what's going on and how can we pair you with people that will make you feel seen and heard so that you can repeatedly hear me too throughout your treatment journey. We have over the past years become the masters in connection. We know exactly what you need and who you need to be with better than you do. We'll then put you into a group with 5 people who are like you, who also are available at the same time as you, who are similar in age to you, have the same primary diagnosis as you that you can connect to, with a facilitator who's a clinician who's trained also in the modality that you specifically need to heal. You'll then be with that group 3 days per week for 3 hours at a time. So it's intensive, but it's episodic care, meaning that there's a start date and an end date. You're with us for a set amount of time, depending on what your individual presentation is. You're receiving that intensive treatment. In addition to the groups, you're also getting individual therapy, family therapy, psychiatric treatment, depending on what you may need. And then we help you transition out of our program. We have a robust alumni community, a step-down program. We also have relationships with just local providers in communities so that we can ensure that you're taken care of after Charlie Health. Even though you're with us for a finite amount of time, we know that healing is a lifelong journey. So we're going to keep that relationship with you 30, 60, 90, 180 days later, in addition to a year, 2 years, 3 years later. We are only as good as our alumni are. Just doing well while you're in treatment with us doesn't really mean anything. We need to ensure that you're also doing well post-treatment with us. And so we build robust relationships with our alumni community and then also with the outpatient providers that they discharge to so that we can track those outcomes and ensure that the care that we deliver while you're in treatment with us is effective. I think that's also just the magic and the beauty of Charlie Health is that we have so much data on how exactly we're delivering care and what works and doesn't work. We're able to collect hundreds of thousands of data points during your treatment journey with us, but then we're also able to follow you afterwards and see how you do. We're trying to prevent readmissions into programs like ours. And so we're tracking your success. And if you're in a specific group that maybe doesn't have as high of a success rate, we're going to iterate on that curriculum, constantly evolve how we deliver care so that we can produce the best possible treatment outcomes. I think you also asked how we get paid, and that is core to, for us when we started Charlie Health, we wanted treatment to be truly accessible. Accessibility means that you can access it virtually. You can access it at any time. So if you're a single mom with 3 kids at home, when are you going to get your intensive treatment options? You may only be able to do it in the morning from 6 a.m. to 9 a.m. Okay, great. I have a group for you. Or maybe you only can do it after your kids go to bed. Maybe you work the night shift in a factory. Awesome. We have a group for you. So we're accessible in terms of virtual, in terms of the time, but also we have to be financially accessible. We're in network with insurance. We have 850 unique payer contracts. We've gone state by state forming relationships with both commercial payers as well as Medicaid payers to ensure that all treatment is covered while you're at Charlie Health.
And hearing you talk about, very serious matters in delivering care and making sure that it's accessible to people, it's like you have this on one hand, it's like incredibly like beneficial that you're able to use technology to deliver care in a way that reaches people where they are and really moves them in kind of the right direction for where they want to and need to be. And on the other hand, you have this kind of issue of like, is it working? How do we know that it's working? Staying on top of if it's working, like leveraging technology in the appropriate way to deliver that care. Just like stepping back, I mean, yes, CEO hat, but just like how are you able to do that in a way that's not just, because I feel my kind of heart rate was increasing a little bit as you're, describing it, because it is such important work. And even sounds cliche, like kind of saying it, like meet people where they are and be there when they need it most. Like that is like the whole thing. And so just what does that actually look like in practice? Like when you think about and talk about it with the team, maybe, or you're hiring clinicians and thinking about that curriculum, like, guys, this is how we have to show up. And like, this is what it means when we do it.
So from the CEO seat, I used to run brick and mortar clinics and residential treatment facilities. And I sleep a lot better at Charlie Health because I didn't know what happened behind closed doors in my brick and mortar treatment centers. A clinician would walk into a room with a patient, and I had no idea what they talked about. At Charlie Health, I get a transcript of every single session. I know every single thing that happens. Every interaction is recorded. Every way that we interact with our patients is tracked. So I know what happens in that session. I know if they're following our evidence-based protocols. I know if we're actually administering good, high-quality treatment, and there's far less risk in how we deliver the care. For our clinicians, that's a new experience. They're used to having a session with a closed door. And so working and partnering with our clinicians has been a core part of how we've grown and scaled. Our clinicians value today how we provide supervision, which is by actually going back into their sessions, rewatching sessions with them. But that took a lot of time to gain trust. Our clinicians needed to learn that they weren't going to get fired because of how they showed up to one session. Instead, we wanted to partner with them. Our values at Charlie Health, I think, nicely define really who we are as an organization. And our first value, and it sounds corny, but our first value is connection, which for clinicians, that's what they're the masters at. And our clinicians are by far the most important employees at Charlie Health. They are the frontline workers. They are delivering life-saving work. Their job is by far the hardest job. Our clinicians have chosen to not go into private practice, which is more lucrative, where they wouldn't have to have a boss, and they would get to choose who their patients are. And generally, they would get low acuity patients. They've made the decision to join an organization where they're going to have someone who's their boss telling them what to do. They're going to deal with more difficult patients and likely make less money than they were going to in private practice because they believe that this is the right thing to do. So our whole organization revolves around the clinician. How do we create the best possible experience for that clinician? How do we show respect to that clinician? They're the masters in connection. How do they teach us to be better connectors and to be relationship obsessed? In order for us to be successful as a company, we all have to feel connected to one another so that we can deliver feedback and be radically candid with each other. That starts, right, with caring personally. So we have to build the connection. That is the foundation of everything that we do at Charlie Health, is the relationship and the connection. The second value is congruence, which is we deliver evidence-based treatment, so we should make evidence-based decisions. We have more data than any other behavioral health company. We understand our patients deeply, and it is our responsibility to then use that data, but use that data for good. I really see Charlie Health rewriting the clinical literature. We will share with people what works and what doesn't work. We're able to examine different data points than anyone has been able to before. We've been able to figure out when you should bring up someone's parent in a session, when you should bring up mom versus dad versus grandma versus whoever else. We are really at the cutting edge of what works and really what works with a very difficult patient population. And that's a first. And we have a responsibility now to share that with other people, to train them. I believe that there will be a Charlie University where people will come and learn how you deliver the best possible high acuity care, because what we are doing every day is changing how behavioral health care is delivered.
This episode of the Fitt Insider Podcast is brought to you by EGYM. EGYM makes some of the most innovative strength training machines on the market, but that's only one part of their integrated ecosystem. With connected fitness equipment, AI-powered gym software, and a comprehensive corporate wellness offering, it's forging the future of preventative health. Partnering with companies worldwide, EGYM's WellPass program improves employee health by expanding access to premier fitness and health facilities. Upgrading gym floors, EGYM equips every operator with smart equipment and AI tools to create hyper-personalized training plans for every exerciser. Putting it all together, they're transforming healthcare through exercise. Experience the power of EGYM's ecosystem at egym.com. There's a lot that potentially we could circle back to as it relates to the technology piece and behavioral health more broadly. But hearing you describe it and just thinking about the gap between, I guess maybe if you want to call it traditional or the existing, whether it's intensive or youth mental health today, like going from a place where, like you said, you didn't know what was happening kind of behind closed doors and what was happening with clinicians and was it working, was it not? And did you have that transparency to being in a place where you know when to bring up certain topics. Zooming out at kind of like an industry or category level, like how does that get solved? Like thinking about just bridging that gap, you described like at Charlie University, but maybe before we get to that point, like how do we start to fill those gaps in a way that the people who do need meaningful care, if maybe they aren't going to Charlie Health, like we start to shift things in a way where they are personalized, they are leveraging technology, they are making sure people, kind of have the access when they need it versus today where there's kind of like, you know, brick wall in some cases or no options or an uncertainty about what to do, not to mention what actually happens when you get into sessions.
Trust is the foundation, and we have to prove that you can use data for good. Our clinicians get to opt in to data collection. Our patients get to opt in to data collection. It's a choice that they're making because they trust us, because they want to engage with us, because they want their care to continue to evolve. We're transparent with our patients. I think that's so important in healthcare. There's total transparency about what is happening. And then we have a responsibility to protect. We have a responsibility to protect that clinician's data, to protect that patient's data. And I think the more that providers can be trustworthy, be human, but also be really safe with the information they have and use it for good, I think that starts to evolve the industry. I think also in general, we just have to tell more stories of success. The mental health crisis has been covered extensively over the last couple of years. And one of my personal frustrations, while I think it's great that we've been talking about the crisis, is that that is never accompanied by people talking about the solution. We have had tremendous evolutions in how care is delivered, and we're not talking about that. We're not talking about what good treatment looks like and how that can change lives. I got into this space, again, through my own personal experience. After I went to residential treatment and received life-saving care, I was obsessed with telling people that I went to residential treatment. That did not make me popular as a high schooler, but I wanted people to know that good, high-quality treatment existed. And that has been my soapbox for the last couple of decades, making sure that people know that treatment exists and it works. And I think that is really the core of what we have to do here. We have to share outcomes. We have to publish our data. We have to speak out. I've spoken at almost all major high schools at some point during my career. We have to keep doing things like that, telling success stories of what works and how good quality treatment can save your life.
Can we just say more about that? Because I think if you were to go through the list maybe of topics that have been quote unquote destigmatized, right? Over the last X many years, call it a decade. It's, mental health and women's health. And, now there's a lot of talk about, non-alcoholic beverages and so you're not stigmatized maybe if you don't drink. And like all those things are phenomenal. And I think we both would on the whole agree with those. But then for you, who's very deep in this space, right? It's your life's work to say, in fact, that's not the case. And so that's kind of counter to what some folks would think in terms of like mental health. Not to say that we have like the solutions or the supply to meet the demand, but just that like we could be talking about like what does that look like in practice? Like, so leaders in the space to go out and be on that soapbox to publish that clinical data is pushing more in terms of, you don't want to call it a marketing campaign, but like campaigns around, is it people that have experienced this? Is it maybe all the above? And I'm just kind of thinking about it from the space of like, oh, even in terms of maybe some of the things that we cover in our coverage, right? In content, and maybe even on this podcast, it's like, huh, in fact, like I could be doing a better job of trying to draw attention to these things. And then maybe I thought that we were individually and collectively. Do you have a sense of like beyond you, Carter, going out and doing these things? Like, how do we do that? Like, what does that look like to kind of move the needle?
I'll use your example of people not drinking. I didn't drink in college, and it wasn't cool. Today, being sober is cool. And I think a lot of that came from individuals speaking out and saying that they weren't drinking and telling their story. And so, no, I don't think it's just me telling my story of sexual trauma, overcoming that, but I think it's lots of people. sharing the darkness, but then sharing the light and continuing to do that over and over and over again. Because yes, we've destigmatized ADHD, low acuity depression, anxiety, but I don't think that we have yet destigmatized these high acuity issues. People who have profoundly struggled, have been hospitalized, have been in residential treatment centers, and now what a beautiful life they have because they had access to good high quality treatment.
For sure. It's more nuanced. It's more nuanced than just, oh, headspace and calm made meditation cool. At the very, top of the funnel or bottom of the pyramid, however you want to look at it, and continuing to push it. And really, I think it's an awareness, but also like a level of empathy and compassion that, like, yes, if you're someone who's experienced that, you want to know and see that there's a path forward, but also more broadly, just understanding that, like, what the treatment entails, what the options are, how people are suffering, and just, yeah, I think having empathy around that to help others in your life if you're not personally experiencing that as well.
I agree. I think we all have just a commitment to continue to share what works and be loud.
When you think about the technology and innovation piece, you spoke a lot about data and that data enabling you to deliver better care and more personalized care, and that being able to impact the industry and outcomes in a whole number of ways. You also talked about kind of trust and safety as it relates to those things. Obviously, right now, any conversation anywhere is, what is the impact of AI and how are you using it maybe to match patients and providers, and how are you doing it to sort outcomes, and how are you doing that to make sure that you're delivering, training and things like that. Are you experiencing that? I guess, what are the positives and negatives, if there are any, that you're seeing now? And are you actually implementing, call it AI, in any way that you see as significant to Charlie Health now and the trajectory that you want to be on?
Absolutely. There are so many positives. Uh, and again, going back to our clinicians are the most important people who work at Charlie Health. And so my job is to make sure that our clinicians get to do what they love to do. They love to be in front of a patient, treating a patient, giving them that evidence based intervention that works and helping them to get well. They don't like doing paperwork. And there is a ton of tools that we've built for our clinicians to augment how they work clinically, to help them deliver care, to improve consistency, to take away the paperwork so they can spend more time face to face delivering the right interventions. And we're continuing to evolve how we assist our clinicians every day. But that has been just such an exciting intervention. We created an AI scribe for all of our clinician called Charles. It's a little cat that comes to all of the sessions. Uh, and seeing our clinicians embrace that, because again, they want to be able to just spend more time human to human, and we're allowing that. We're also just making investments in how we can improve our clinical model, how we can maximize outcomes so that we can deliver the best possible results, how we can drive down overhead and just wasteful admin work and focus on the best possible results for our clients. As I said, we're rewriting the clinical literature. No one has the kind of platform that we do, and we want to benefit not just our clients, but the broader field. And that's where I think AI and technology can play such a huge role for us. And I'm excited. I think people ask me all the time, do you see AI as a threat? And for our specific population, I don't see a world where you could replace the role of a clinician with AI. I think in the low acuity space, and I know personally for myself, I talk to chat every day, and it has significantly reduced the amount of time I need to spend with a therapist or with a coach because I can ask chat for advice. We can go back and forth. There's reflective listening. That's tremendously beneficial for me as a leader. And I think for low acuity mental health issues, AI will continue to evolve and potentially dominate in that space. For this high acuity population, I think we need the human interaction. Again, so much of the magic of Charlie Health is that group and that connection and community. And there's also tremendous risk. We've seen articles about what has happened when suicidal patients talk to chat about their issues. So I don't think that we're in a place where high acuity patients would be churning there. But I think that there's ways to augment care, but it will never be a substitute for that human intervention.
You've talked a couple of times about really shifting the broader landscape, improving how this type of care is delivered, where you see you can have an impact. Just kind of what does that roadmap look like? How are you thinking about whether it's expansion, new populations, doing it at kind of like the care level? What's on the roadmap for Charlie Health, and what are you thinking about and talking about with the team?
So today we treat people ages 8 to 65. We started with mental health, and I'm excited that we've expanded into substance use disorder. I believe in that space we can make a tremendous impact. Our overdose prevention work is already working. We've always managed clients with substance use disorders, but we've now expanded into true primary substance use disorder treatment. And I think that that will further evolve how care is delivered. It's more than just medication management or medication assisted treatment. And it's that connection and community piece that we know is so healing to people who are struggling with substance use disorder. So I'm really excited about that. And then I think just continuing to expand our geographic footprint. We're in 40 states today. I would like to be in every state, and then we'll see where we go from there.
In terms of continuing that expansion, to this point, has that been, and I guess kind of going forward, is that a matter of, look, we need to raise funding to expand. We need to keep doing what we're doing. We need to enlist more of these insurance partnerships and providers. What are those, if you think of them as KPIs or just the barriers to saying like, yeah, this is how we go from 40 to 50, or this is how we break into the new kind of categories?
The number one KPI for us is just lives served, right? How many lives, how many people are we able to help? Right now, over 150,000 people in the US die every year from suicide. Nearly 2 million people are hospitalized for a mental health or substance use issue. We have a lot of work to do. Even though we're 6 years in, I still feel like we're an early stage startup, and we have so much room just to continue to grow and expand. In terms of fundraising, my goal has always been for the business to be self-sustaining. I think that's really important when you're working with at-risk people. We would never want to leave a community. We would never want to turn our back on a patient. We have suicidal patients who depend on us. And so leaving a community, running out of money, doing a layoff, that's just always been a non-starter. We've raised capital selectively and opportunistically to help us expand and invest in initiatives like technology and clinical care initiatives. We're profitable today, and sustainability has always been paramount to our success. I think, again, back to that accessibility piece too, a large part of what we do is we scholarship people into care with us. We believe that our treatment should be accessible. And so for people who are uninsured, we're not going to use their lack of insurance as a reason for them to not receive care with us. So that's been a big part of Charlie Health and our story since the beginning as well.
And then as you do continue to expand, for folks that are listening, potentially partners and folks that can work with you as you do continue to grow, and certainly anybody that is in need of care, where can folks learn more, follow along, get in touch, and just keep up with what you're doing?
charliehealth.com, best place to get in touch. Please reach out to us. We are hiring every day. We said at the beginning before we started recording, it is my biggest job is hiring great people and setting them up to be successful at Charlie Health. It's my favorite part of my job, getting to bring on new exceptional teammates. So please reach out if you're looking for an opportunity to join a great team.
We will make sure everything's easy to find in the show notes. And thank you for all the work that you do, for spending some time to chat with us today. And super excited to share the conversation.
Awesome. Thanks so much, Joe.
Thanks for listening to today's episode. If you got value from the conversation, please consider subscribing and sharing the podcast with a friend or colleague. It's a massive help. And if you want more content like this, including news and insights on the latest industry developments, subscribe to the Fitt Insider newsletter at insider.fit.co. And one more thing, you can learn more about our recruiting and consulting services at fit.co. That's FITT.co. I'll see you here next week.